We'd like to remind you that if you are experiencing symptoms of a heart attack, stroke, or any life-threatening medical emergency, please call 911. Please do not delay seeking treatment during the COVID-19 epidemic. Most Providence emergency rooms are open, and CDC-required safety measures are being taken to protect patients and hospital staff. If you are unsure of your symptoms, please use our telehealth services and speak with a healthcare professional that can better assess your symptoms and provide direction on the best course of action. Please do not let the worry of COVID-19 cause delay in seeking out treatment if you are experiencing a heart attack or stroke. Every minute treatment is delayed can be fatal. Thank you.
Thank you for tuning into the Future of Health on Dash Radio during this coronavirus pandemic. We're lucky to have many experts around our COVID-19 topic and many guest hosts. Remember to visit coronavirus.providence.org for more information.
Good afternoon. I'm your host, Dr. Amy Thompson. I'm the Chief Executive Officer at the Covenant Children's Hospital in Lubbock, Texas. And I'm so pleased to join you today and talk about this very interesting topic of children and COVID-19. It's my pleasure to have Dr. Rick Lampe today. He's going to join us, and I'll introduce him in just a moment. So as a reminder, the information provided during this event is for informational purposes only. If you have any questions around the COVID-19 pandemic, please visit our website at providence.org for medical updates. This event does not create a doctor-patient relationship, and any questions or medical advice discussed is not considered guidance on what you should do. Any medical questions, please reach out to your primary care or healthcare professional. So it's my pleasure today to be joined by Dr. Richard Lampe. He is a pediatric infectious disease specialist. He's worked at Covenant Children's for over 25 years. I had the distinct privilege of being trained under Dr. Lampe, and he's one of my mentors, and just a very, very, very good pediatrician who is very knowledgeable. So Dr. Lampe, thank you so much for joining us today and for talking to us about this very interesting and timely topic.
Thank you. My privilege to be doing this with you, Dr. Thompson.
So I'm going to start off with just a really easy question, which is a lot of people are like, what is a pediatric infectious disease specialist? So just tell me a little bit about what it is that you do in your role as a pediatric infectious disease specialist.
Yes, no, thank you. Well, first of all, after medical school, you train as a pediatrician. Right now, that's for 3 years. And then it's a fellowship training in pediatric infectious disease is at present 3 years. So a person who accomplishes that successfully is board certified not only in pediatrics, but also in pediatric infectious disease. That means that they have seen meningitis and pneumonia and complicated infections of a bacterial, viral nature, often in children who are normal initially, and then sometimes in children who have cancer and who are immunocompromised or who have immune deficiencies. It's been my privilege to do this for nearly 50 years.
That's fantastic. Well, thank you so much for joining us today. I'm going to just jump right in. I know the topic that's very much on everyone's mind here is COVID-19. So I just want to talk about at the beginning, true that children are the least susceptible to COVID-19, and if so, why do you think that is?
You are correct. They can catch it, but fortunately, the younger age groups do not have as severe a disease as adults. We don't exactly understand fully why that is, but it is clearly the case. We are beginning to learn about this new pandemic virus in the past 6 months, and so it is an evolving story. I think that children, as a rule, have strong immune systems, and I think that may be part of it, whereas older individuals have less good immune systems or have other medical conditions that may lead them to be more susceptible.
Yeah, and that's been our experience here at the Children's Hospital as well. As while we've certainly seen a lot of children who have tested positive for COVID-19, we've had a small group of children that have actually been admitted to the hospital. And many of those kids were kids who had what we call comorbid conditions. So, asthma or heart conditions, different things like this that made them, it seemed more susceptible. But that has certainly been something that has been part of our experience as well.
That's right. And as I recall, they also may have acquired that infection or been exposed to it in the community or from one of their family members.
Yeah, I was reading an article just last couple of days that was talking about they really feel like that the majority of kids who actually can, have symptoms of COVID-19 likely got it from an adult that they were, exposed to. So what about parents? What about parents that are out there and they're worried that their child has been exposed to COVID-19? What is it that you tell them to do?
So it depends on the nature of the exposure, but I think it's natural for parents to be worried. You'd be worried about your child, whether they're a month old, 18 months old, 8 years old, or 18 years old. If you feel that they've been exposed, what we know is that from the time of exposure to the time of symptoms, it can be as short as 5 days, but often a little bit longer, 7 or 10 days. It doesn't, if one is going to test to see if they've acquired it, if they're exposed, it doesn't do much good to test it until after 5 days of exposure, provided you can get a reliable test that gives you the answer back quickly. So there's a, if you will, incubation period. If they're exposed right now, if it's a significant exposure and it's known, it's probably better to isolate and quarantine and not be around other people.
Yeah, I agree with that. So talk to me about symptoms. So we've read about a bunch of symptoms. I know that they've been evolving, but talk to me about the difference, or is there a difference between the symptoms for kids and adults with COVID-19?
Yeah, so the children sometimes can be totally asymptomatic. So I don't think they may not show the same symptoms, but then they show the typical ones, the ones that do have symptoms: cough, fever, respiratory. Children, it appears, have more GI symptoms, vomiting, diarrhea with it as well. As we learn more about it, the ones that worry patients, that worry doctors, are ones where there's high fever and a red rash, or high fever and just looking really sick. Those people need to be seen immediately. But that, fortunately, is a very, very small percent of all the infections that happen in children. But it's the one that we hear about on television as much more often.
Yeah, I agree. And that's that multi-system inflammatory syndrome that they're seeing with this, similar, I think, to Kawasaki's disease that we learned about. But that is exactly the symptoms that we worry about. And if you're a parent and your child you feel like has been exposed and is having those symptoms, make sure that you follow up with your primary care physician or at a healthcare facility. So talk to me about kids who have a predisposition. Are there kids that have certain disease types and other things like this that make them where they have a higher incidence of either getting COVID or having symptoms from COVID?
Yeah, well, in this case, since it affects the children's lungs, those children who already have lung disease, and you had previously mentioned asthma, that a common lung condition in children, or other serious lung conditions, cystic fibrosis or some chronic lung infection, they are more susceptible. If some premature infants who have been in a neonatal intensive care unit for weeks to months and then are on oxygen at home may be more susceptible as well. That would be one group just because of their underlying lung disease. The other group that appears to be at risk would be children who are receiving chemotherapy for treatment of cancers, leukemia, or solid tumors. They would be at risk, just like they're at risk for bacterial infections. They would also be at risk for certain virus infections, and COVID is one of those viruses that they would be susceptible to.
Yeah, I agree with those. And, really, that's the same kids that we worry about that when it's flu season. And, some of those are the same kids that we worry about in RSV season. So other things that affect children, those are always the kids that we're, the most worried about with any respiratory illness, are kids that have, underlying respiratory issues, but also kids who, have a weakened immune system, because of that. So I want to go back just a little bit to this multi-system inflammatory syndrome. And so we've talked about, the things that parents, need to watch for. But I've been asked a lot of questions about, specifically, are there vaccines for this syndrome? Or, interact with that question?
So at the present time, just as of August the 3rd, 2020, no vaccines for adults or children, although those studies in adults are ongoing as we speak. And we certainly hope we'll have some near the end of this year or hopefully sometime during 2021. I think from that standpoint, as you were mentioning RSV and influenza, there are some things that we can do right now that can help us help children. And that is the flu vaccine for all people above the age of 6 months is absolutely indicated in the United States for this year, because we don't want to have influenza on top of COVID in the same patient. So preventing, and the best way we can prevent influenza right now is with a vaccine, as well as washing our hands and all the things we're doing to prevent COVID, social distancing and masks.
I agree with that. And actually, we are going to be hosting another Facebook Live event where we're going to be specifically talking about immunizations, not not an immunization for COVID, although we hope that one of those comes, but the importance of during this time of making sure that you're getting your children vaccinated against other diseases. So look for that as well. So what are the special kind of precautions that healthcare providers are taking around children with COVID?
So I just finished this morning doing rounds on some patients, washed my hands, wearing a mask. All the nurses, everybody in the hospital are wearing masks, washing their hands in between patients. If they're hospitalized, we do the same thing in the clinic. It is safe to visit your providers in a clinic. They're taking appropriate precautions of hand washing, masks of all the people in the offices. As you pointed out, I'm blessed with an 18-month-old grandson. He needs his routine immunizations. We want him to get those. He lives in a different city in Texas. Important to maintain those healthcare and those routine immunizations. We don't want to have an outbreak of measles or whooping cough 6 months from now. That we just don't want to deal with that. We can prevent that.
Yeah, I agree. I agree with that. We're doing the same, type of precautions, obviously, here in the hospital, where we have everyone wearing appropriate personal protective equipment with masks and face shields and things like this. And then I just remind people as well that we're still encouraging, obviously people think about that whenever they come into healthcare establishments, but we need to remember that those things that you talked about, masking, social distancing, washing the hands, all of those things are important, not just in a healthcare, setting, but, in all kinds of settings. And so we did have a question here about, and you kind of addressed that, that in your opinion, for sure, people should still take their kids to the pediatrician, have regular checkups, regular vaccines. This is not a time to keep your kids at home. So any other thing that you would interact with on that?
No, I think that is important. I saw a patient in your hospital yesterday. Again, mask, social isolation, social distancing. It is a safe place, even in the neonatal intensive care unit. People are particularly careful with hand washing, masks, and all of those susceptible babies. Very important to do that. It is important for routine care in the midst of this pandemic. We will get through this, but we don't want to, we want to maintain a good medical home and access to common conditions as well. I'm optimistic.
Yeah, me too. I agree. So now it's August and we're there's probably a lot of folks who are watching that have school-aged children. So interact with the previous time when we did this Facebook Live. It was the beginning of summer. And so we were talking about special precautions, kind of during the summer began, but now we're looking at back to school. And so interact just a bit with, what things do people need to think of as we enter back into this, some kids for sure going back to school.
Yeah, that is an excellent one. I think one has to individualize it into the area in which they live, be it California, Washington, Texas, wherever in the United States. Things have even changed from June to August in the United States. it reflects, I think, the age of the children and the importance of them attending school. It is going to be a decision of parents, children who are old enough to make those decisions, such as teenagers, and the school district. I expect that those schools will be social distancing. They will be asking and requiring masks on children who should wear them if they're old enough to do that. And there will be distancing and classes that will have access to plenty of hand washing. There may be mixtures of attending school where some is online, some is visits, alternate days. I think each city and each area that is going to have to be an individual decision. Clearly, we have a grandson who's in daycare. He's going to go to that. The other children, depends on their school district and the infection rates in the respective cities. They may do some mixture of online learning, but it's important. The American Academy of Pediatrics, everybody thinks children should be in school, not only for learning, but also for the socialization and developing some of those other skills that they can only learn in schools.
Yeah, I echo that. I'm very glad that you brought up the point about the American Academy of Pediatrics. It's been something that we've talked a lot about is the other benefits of kids being in school. I, like you, I have children, and I have the privilege of being on they call it the back to school committee at our school, and just talking about the different things that we want to do to make it a safe place. And it's all the things that you have mentioned. It is making sure that we're wearing, that the children who are old enough can wear masks. One of the suggestions that we have given is I do sometimes like we call them the gator masks, which are continuous around your neck. I have an 11-year-old, and that's very helpful, but he doesn't lose it. So when I put it on him in the morning, that mask stays on, and he can just pull it up, and he's not able to lose that. And in fact, we are, as a hospital, we're giving masks to all of the schools here in Lubbock to provide for the kids, just because we really believe in that masking component of it. And the other thing that we've really emphasized is the same things you talked about. What are ways that we can social distance, making sure that we wash the hands. But then we've also talked a lot about teacher safety and making sure that those teachers feel that, they also need to be wearing masks. There are certain, of those adults, teachers that we have encouraged because of the pre-existing conditions, even to wear a more specialized mask when they're with kids. We've also laughed in the Thompson household. We're doing a lot of air hugs, as we call it, and giving instead of high fives, doing bumps and just figuring other ways that we can help our kids feel loved, but that doesn't require as much, the personal touch and being in each other's space, and trying to make that fun. So we've really talked about that with the teachers. So I do want to talk for just a sec about this psychological effects. I both want to talk about kind of a twofold question. So I'll start with, what do you think are the psychological effects that this entire thing has had on our kids as we have faced this pandemic?
I think when we talk to children, we have to know their developmental stage. For instance, the concerns of a teenager are different than the concerns of a child in the first and second grade. So addressing those from the parent standpoint, I think how parents handle it too. This is an opportunity, if we can, to teach resiliency. Mm-hmm. We will get through this. We should pay attention to people, to doctors and scientists, and pay attention to things that we believe and we know are going to protect us, and then convey that in the appropriate terms to children according to their age and developmental age. But, teenagers, those are stressful years. There already is an underlying anxiety and depression that is there, and the pandemic may have contributed to that. So I think addressing it and keeping a close eye on children, and being open and talking about it. We used to say, too much screen time is bad, but now a lot of screen time is learning as well. So you have to find that right balance. I think this is an opportunity to teach resilience, but to do that, the parents have to have resilience, and their parents and other relatives and older children have to model that as well.
I agree with that, and it's been interesting. My own children are different ages, and I think you're right on this age appropriate discussions about COVID. I have an 11-year-old, and I really feel like he ends up having a lot of questions, and I would actually say that he is very fearful, and so we've had to have a lot of questions about his fear of going back to school. He also, interestingly though, I'll get to this part of the question in a minute, but man, I don't know that he has always loved school, and he has asked me more in the last few months when it is that he can go back to school and see his friends. And so, that my 11-year-old is kind of in this place where he very much misses his friends and but is scared of the disease. And so having to have a lot of conversations with him about that. On the other hand, I have an 18-year-old. And I say that in many of the 18-year-olds, and actually, if you look at the data for, right now, that, kind of 18 to 29 is really the area where we're seeing large, numbers of outbreaks. And I mean, my son would be in this category of he needs to have more fear of the COVID-19. And so I do think that sometimes in those older kids, that's consistent with their development as well, is that they don't have a lot of fear. And so really having to, talk with him, we have had to try to make those conversations around, I want you to think about your grandma, and I want you to think about adults that you'll come into contact with, and you choosing to do things like masking and social distancing and washing your hands. I want you to see that as a service to, the people that you go around. So I agree with you. You really have to think about, what age and specifically how your kids are interacting with COVID-19. So talk to me also about, kind of the psychological effects. I had a senior this year. And so when we talk about, all of the things, I think we also have to recognize kids have lost things. I mean, I had a senior who didn't get to go back to school after March, had they didn't get to have prom, all the things that you think about, forever. And we had to do an outside graduation, much later, than we were anticipating. And so, talk a little bit about, even some of the loss and stuff that kids have made, and maybe what your suggestion would be about how to talk with them about that. And also, if you think that getting them back into school, at least even if it's online school, will help some of those things.
Yes, thank you. Like you, two of our grandchildren graduated from high school this year, neither of which did it in the usual fashion. And so that is a loss. Getting them, I think addressing it, I think, as you pointed out with your son who graduated high school and wearing the mask, teenagers feel they're immortal. They can't be hurt. But yet responsibility towards their teachers, or if they're going to college, or their other relatives, be they older, wearing masks is a responsible thing to prevent it from them. That is, I think, a good start. The middle-aged children are anxious to meet their friends, as are the ones in high school. This experience, they probably don't want to hear this, but this experience is going to teach them that they can deal with some challenges. And I think it will, it has the potential, and it should help them be resilient and to be able to handle challenges that are unexpected. Next week is unexpected in the medical field with this, but we have the resources to handle it. I think that there can be online, and people can talk to counselors. You can look at resources that are available in your community of how to deal with some of the isolation. It certainly has helped me to have FaceTime with some grandchildren.
Yeah, I agree. And I also laughed at the creativity of some of these students on how it is that they're doing some things. We have had some drive-by graduation parties where people stand out in their front yards and folks in their cars drive by. They decorate the cars. They And that's actually how we did the seniors at our school every year have an end of school parade where all of the kids, come by. And so they just spread those kids way out, and all these people decorated their cars. And so I do think that it has been interesting to watch people rise to the occasion and be able to celebrate some things and do some things, Yeah. Let me just ask, I'm sorry, go ahead, Dr. Lampe.
I was going to share this with you. So the new medical students have begun, the new first-year medical students. And of course, they can't be welcomed in an auditorium and all those things. So last Friday, they drove by in cars and received black bags, white coats, all the information, masks, to get them oriented to their today being one of their first days in medical school here at Texas Tech. So yes, both in leaving and celebrating, and then helping people into a new situation. As some of these recent graduates go to college, it's going to be different, but there will be strategies to welcome them that all of their classmates will participate in as well.
Yeah, I agree with that. I think it's been great. Well, Dr. Lampe, I want to thank you for joining me. I just want to end with kind of one last question. Is there anything else that you would want to tell us that's just, on your heart about, specialized children's care during this pandemic?
Yeah, so I think, just like teachers love children and want to do what's right for them, so do doctors, who particularly pediatricians. And so I think that we owe it to do our best, as teachers do, and at the same time, parents who are responsible for their children want to help those children accomplish that, both health and learning. And I think that partnership is going to be really important. Trust the people that you believe in, be it clergy, doctors, teachers. There's a lot of people out there who want to do what's right for people and children in particular.
I agree. I echo that. And if you're a parent or a teacher, anyone who's listening to this, today, my encouragement is make sure that you get good information. So get information from your pediatrician, from a family doctor. Make sure that, you stay educated. I always say, let's don't always just look at the generic internet, for information, that, really look at reputable sites for, information about COVID, but always want to encourage you to reach out to your physician and ask questions. I've had a ton of my friends who've said, I'm sure you're sick of talking about COVID, but will you sit down and talk with us, because, we have fears about this. And I can honestly tell you, I'm not sick of that, just because I feel like that's what our training has afforded us. So Dr. Lampe, thank you so much for joining us today. It's always great to see you. And if you're out there and you have more questions about COVID, please go to our website or try to get in touch with one of your primary care physicians in the region. Thank you guys so much for joining us.
Thank you, Dr. Thompson.